Hello, everyone, and welcome to tonight's episode of Navigator Nuggets. I'm your host, Dr. Nicole Rochester, board-certified pediatrician, former caregiver, independent health advocate, and the CEO of Your GPS Doc. As you can see, I have an amazing guest with me today. Her name is Dr. Sylvia Bollie. Thank you so much, Dr. Sylvia, for joining us. Dr. Bollie is a board-certified internal medicine and obesity medicine physician. She did her medical training and her residency at George Washington University Medical Center here in the DMV area where I am from. And she practiced primary care for 6 years and obesity medicine for 2 years. And she currently works in a nursing facility. And that is why I thought it was so important for you all to meet her and hear her story. As you all know, we are still in the midst of this coronavirus pandemic. And, the nursing facilities, the nursing homes have been hit probably harder than any other group. And we all know that the mortality among the nursing home residents has been extremely high. In fact, in many cities, they're reporting that 60% plus of all of their deaths are in nursing homes. So, it's been a huge issue for those in nursing homes and for caregivers and family members who love the individuals who are in nursing homes. So I wanted to bring Dr. Bollie on so we can talk with her and get her professional opinion. So thank you to all of you who are joining us live. I will tell you that this is pre-recorded because, as you all know, when I speak to frontline physicians, they have jobs, they work. So we have to catch them when they are able. So I'm very grateful that Dr. Bollie is taking time out. So we are recording this on Saturday, March 16th. And the reason I'm telling you that is also because I'm going to share with you some statistics. But of course, by Monday, when this airs, unfortunately, these statistics, I'm sure, will no longer be accurate. But as of today, which is Saturday, March 16th, there globally have been 4,605,673 cases with a little over 310,000 deaths. Here in the US, we're at 1,456,841 cases and 88,447 deaths. So again, I'm sure by Monday, those numbers will be different, but that's where we stand today. So welcome. Is it okay if I call you Dr. Sylvia?
Absolutely. I prefer that. Thank you.
Awesome. So thank you, Dr. Sylvia, for joining us tonight. So I guess the first thing I really wanted to do, Dr. Sylvia, is just to have you tell the audience a little bit about yourself and your journey and why you work in a nursing home. I think it's really important to humanize physicians and other healthcare professionals in general, but especially during this pandemic when, I'm seeing all the chatter on social media. And while a lot of it is positive, you see things that say that the doctors don't care about you, specifically in the African-American community, many people are afraid to go to the hospital. They're afraid to put their loved one in a nursing home. And unfortunately, there's still this general perception that, things are being done to people and that the doctors don't care. And knowing you personally, I know that nothing could be further from the truth. So would you mind just sharing with us a little bit about your journey and why you decided to work in a nursing home?
Yeah. Well, first of all, thank you so much, Dr. Nicole, for having me on. I love Navigator Nuggets. I share it on my own Facebook page because I think you do such an amazing job of just preparing and putting the information out there for people in a really understandable way. So I'm so grateful to be on your Facebook Live today. So thank you for having me.
It's my pleasure.
First and foremost.
Absolutely.
So a little bit about me. You've already given them the basic introduction. I'm internal medicine and obesity medicine certified. But before all of that, what brought me to medicine and what ignited that passion in me was actually my grandmother. So when I was 8, my grandmother immigrated from Liberia, West Africa. At that time, that's where both of my parents are from, even though I was born and raised here in Atlanta. But my grandmother was in the midst of a civil war. There was the healthcare infrastructure there was decimated. So during that time, she developed a lot of health conditions, diabetes, hypertension, she had obesity, she actually went blind during the midst of the war. So by the time she got here, she needed a lot of health care to be done. And one of my roles as the oldest daughter would be going with her and my mom to these appointments and seeing how she interacted with the healthcare. So one thing that I didn't know then, but I recognize now, is that my grandmother was actually going to resident clinics, because she was using, so she was going, because I wondered, I noticed then the difference in the care my grandmother received from the care I received by seeing the same doctor all the time. So I was wondering, why is her doctor always changing and rotating? Why are we always having to repeat the same things? So even as a kid, I was noticing these differences. Fast forward a few years more, my grandmother had a massive stroke, and we actually, unfortunately, weren't able to take care of her at home anymore. So she had to go into a nursing facility. Initially, they tried rehab, and then she moved to a nursing home. And she was there for 4 years till she passed away. So during that time, I got very familiar with the healthcare system, and especially in the nursing home. So I always said in high school, and it's funny because one of my good friends from high school, I was looking through my yearbook, and I saw a picture of me visiting, not my grandmother's nursing home, but I used to visit other nursing homes too and sit with the patients and the residents, because I love that population. It gave me energy. So I had a picture in my yearbook of visiting with this geriatric patient, and I just started working at the nursing home again recently, and she was like, "Yeah, but you always talked about this in high school." I was like, "Really?" I could not remember because my past in residency, in medical school, and even working as a primary care physician kind of took me away from there. But recently in January, my father unfortunately passed away. And that was life changing, of course. And so one of the things I decided to do was to revisit some of my passions I had before medicine, before coming into medicine. And so I said, one of the opportunity arose to work in a nursing facility. It's a rehab, long-term care, and then also nursing home. So I said, I've always enjoyed this population. Let me give it a try. And so that was in January 2020, before we even knew about Corona.
Wow.
I had to do all the services for my father. That took up most of February, and had some international travel involved. And so I came back. So I started in March at the facility, right when the coronavirus pandemic was hitting the U.S. shores, and then all the changes were starting to happen in the facility too. So that is when I started started as working in this nursing facility. So it's been interesting.
Wow. Well, let me say, I'm very sorry to hear about your grandmother and your dad. We share that
Thank you.
similarity. And, I just think I'm always inspired when I meet other doctors and healthcare professionals who, take that personal experience and then turn it around for good. So, I'm sad that happened to you. But, I'm sure that the residents that you take care of are absolutely blessed to have you. So, if that played a part in your desire to work with that population, then I think that's a positive thing. And I didn't even realize that you transitioned to working in a nursing home right at the beginning of this pandemic. So speaking of that, as I alluded to in the introduction, things are just absolutely chaotic right now, really for all of us, but particularly for patients in hospitals and their caregivers, and for residents of nursing homes. And, I know a lot of people are afraid, and we can't visit our loved ones. So what are some of the things that you, based on your expertise, what should the nursing homes be doing? And why are we seeing such high numbers of cases and deaths in nursing facilities?
Wow. Yeah. So I think the first step is, you're right, it's a huge problem. As of the first week of May, which these numbers, like you said, may have changed. We're talking now on May 16th, 2020, but these numbers may have changed. Nursing homes accounted for 19% of Maryland's COVID cases, and it accounted for 46% of the deaths, total deaths. So part of the reason why these numbers are so stark is because usually in a nursing facility, you have the most vulnerable population for COVID-19. That is, we know that COVID hits people over 65 more severely. Anyone who has comorbid conditions or has chronic health conditions like diabetes, heart disease, renal failure, obesity, all of these people are affected disproportionately. And so when you put them all together in one place, it makes it very, and we know it's a highly contagious disease also too, or a pathogen. So when we are put all together in one place, I think it's just a perfect storm. That coupled with some of the national problems that we saw, which were a lack of testing early on. Like in an ideal world, everyone should have been tested and continually tested weekly, but we didn't have enough tests. Lack of PPE, which is personal protective equipment. I'm fortunate to work in a facility that had some, or we have enough, but compared to the old standard, I always say pre-COVID PPE and COVID PPE. Like we all know, for those of us who have worked in medicine for years, like what we're calling PPE now is nothing like what we used to do for infection control. But, you know, we grin and bear it. We do what we have to do to get through. But so I think that is all the perfect storm for why COVID has hit the nursing facilities so hard. And we don't even just see it in this country, but in France, in Italy, like it's internationally because of those reasons.
Wow. Yeah, I mean, thank you. That's an excellent summary. And it is a perfect storm, unfortunately. You take high-risk patients and then you put them in that environment where, you know, they're sharing rooms with each other and everything else that you mentioned. And it's just a recipe for disaster. So what should the nursing facilities be doing? You know, if people that are watching and they have a loved one in a nursing home, what should they expect? What type of precautions are being instituted or should be instituted to keep our loved ones safe in nursing homes?
So I would recommend to your audience, the CDC has it as public information, the long-term care guidelines for COVID-19 or for coronavirus. So everyone should be following those as a basic. That's the basic level. And that has been a stepwise approach. The first thing which your viewers are probably experiencing is that outside visitors and non-essential workers were not allowed to come into the facility. That actually started from about March 12th of 2020 of this year. Then there was screening done at the doorways, even for essential workers. So every day that I go in, they check my temperature, they ask about symptomatology, a mask is given at the door, and hand washing or hand hygiene is done right there. So that's some of the basic things. Then within the facility, you want to find out if testing is being done routinely on symptomatic and even asymptomatic patients. Now the National Guard has stepped in. I have seen an increase in testing capability. Earlier on, this was not available, like in all of March and even into April, late April. But once the National Guard got involved in early May, we've been able to obtain testing. So you want to make sure that testing is being done at your facility. What testing allows us to do is to separate the patients who have COVID away from the people who do not have COVID. And you want to, that being said, there should be a dedicated COVID unit. So where are the patients with COVID being housed? How are they being treated? And they should have isolated staff. So staff that does not cross mingles with the other patients, because that's another way that it can be transmitted as well. So I think those are some of the general things that should be done. In addition, of course, staff should be wearing full PPE, following the strictest infectious precautions by using coronavirus killing materials, so whether it be the bleach wipes, whether it be other sort of things that we use, and really trying to reduce the spread within the building. Disposable utensils, disposable cups, all of these things should be instituted as recommended by the CDC.
Wow, I didn't even think about disposable utensils. I didn't even think about that. Usually they're eating on plate, regular plates and using like silverware. I hadn't even thought about that. Can you explain a little bit more about the National Guard? What is their role with regard to testing?
So now here in Maryland, when there was a shortage of everything, so the governor actually asked the National Guard to step in so you can use them as an emergency resource. So what they were able to then do was to appropriate funds, appropriate resources directly to the nursing homes as separate away from the hospitals, so that they were able to come in, check on the infectious control procedures that were being done in the facilities. They were also able to do staff development and teaching as well where it was needed. And also we were able to obtain more testing and personal protective equipment as well.
Wow. Do you know if that's happening in other states across the country?
Actually, I can't, I think it may have happened in New York, but I'm not certain, but definitely here because it is a state decision, not a federal one.
Got it. That's good to know. That's good to know.
Mm-hmm.
And then you mentioned, regular testing. And we know, those of you watching, we've talked about this on previous episodes of Navigator Nuggets, even in the general public, how, the lack of appropriate testing has really been one of the key elements that's missing in our strategy to fight the coronavirus. And it's playing a role in, the state's ability to reopen. That's a whole nother topic that I'm not going to touch today. But having said that, my concern, just as a physician, is, how often I feel like we could test every day, and I know that we will never have an adequate supply. So, in reality, what's actually happening in nursing homes, in nursing facilities? Are they testing staff once a week? Are they testing staff, every other day, once a month? Like how are you all dealing with the challenges of needing to test? Because we know that asymptomatic people are, definitely the ones that are carrying this virus and spreading the virus. So how do you weigh that challenge of testing often enough to really catch people, even if they're not having symptoms, to prevent them from spreading it to other staff, other residents, but also knowing that, we don't have thousands and thousands of test kits for each nursing facility. So how often are you all testing?
Unfortunately, the lack of testing has affected us all. And so really, in our facility, how it's been working is if the staff member becomes symptomatic or if they have no close contact with a positive patient, then they're tested. And the testing was primarily being done in the community where they needed to go to their primary care physician or to the health department and not necessarily at the facility. What's going to happen this week, though, again, part of those National Guard resources and also from Johns Hopkins University as well, too, was able to give us some testing. So every staff member is going to be tested going forward. But the primary screening that was done was the questions, which was what was recommended initially by CMS and CDC. But that was the initial thing when we didn't have the tests available. And tests were reserved for symptomatic patients or staff.
Yeah, and I mean, that makes sense. I guess, one of the things I want you all to understand, and if you don't already, is that these are difficult times, right? But for healthcare professionals, we're really having to deal with like what we would do ideally versus what we can do. And, you all have probably heard stories about people in some states, having to reuse PPE. I mean, these are things that we have never, ever done before. We've never used a mask for even an entire day, let alone an entire week. And, we're used to being able to just, test people when we need to test people. But you can imagine, if you take all the nursing home facilities, just where we are, where Dr. Sylvia and I are in the state of Maryland, there's no way that you could test every single staff member and every single resident, daily or even weekly. So, we're having to, and the CDC, everybody's having to develop guidelines that really do their best to keep the residents and the patients safe, but we acknowledge that they're not ideal, but we just don't have an unlimited supply. And I think that's really what's heartbreaking, is that it's not that we don't want to do the right thing, but we're having to do our best with very limited resources. And all I can hope is that when this is over, whenever that's going to be, that our country, that our government will really look at this carefully, and that we will, do much more preparation and be much more proactive. I've heard people say that, I just listened to a webinar actually the other day, and the nursing home administrators on the call were saying that in some ways they feel that nursing homes were kind of neglected in the initial strategies, and that all of the PPE and all of the testing and all the resources were going to the hospitals. And yes, that makes sense because we were focused on like the sickest patients, but I don't even know if it dawned on people that we have these elderly and these, chronically ill, highly vulnerable patients in the nursing homes. And it was almost like your residents were like an afterthought. Do you agree with that, Dr. Sylvia?
I think that's what has unfolded, and what the truth is. What the truth is, it's a harsh reality to hear. But honestly, I can say that what the COVID-19 pandemic has done is just magnify whatever existing flaw there was in any system. And so even prior to COVID-19, there were flaws within the way that we cared for our elderly or our chronically ill, or within nursing facilities. And so that's why we're seeing it there. That's why we're seeing it within the African American community, within the Latina community, within men. In PG County, where I work, 65% of the COVID cases are in Black men. So wherever there is a flaw, wherever there's a need in the system, that's what COVID-19 has done it has exposed it. So I think that is part of why also the nursing home needs were not looked at so highly or so acutely in the beginning.
That is
prioritized, I should say.
Excellent point. Such an excellent point. Thank you for saying that. You're right. I mean, this pandemic has really just, it's been like a flashlight or a magnifying glass. And like you said, it's highlighting things that we already knew existed. So in some ways, I mean, if there's anything positive that's going to come out of this, my hope is that as a result, now we know, like, we can't hide anymore. We know about health disparities. I mean, many of us, we already knew this, but the health disparities are now on display, and the disproportionate care that elderly and disabled people get, all of that is on display. And so, hopefully we will take some action and do something about that. This has been awesome. I guess I just want to wrap up by having you share any tips that you may have for a person, a family caregiver who either has a loved one in a nursing facility right now, or maybe they have a loved one in the hospital and they're, the social workers calling them and saying, we think your loved one should spend some time in a nursing facility, a rehab facility. What tips do you have for family caregivers in those situations?
I think that, first of all, my heart goes out to you for having to be in that situation. This is just a really, really hard time for families. And, all the families that I talk to, that's the first thing I lead with. I deal with various ranges of emotions when I talk that patients' families present me with, from kindness to anger to fear, but I get it all because I feel like it's a tough time. Like, I can't even imagine if I were not able to see my grandmother for 4 weeks. We used to go there every day. So almost now, what has it been? Almost 8 weeks that some people can only see if they're lucky, if their loved one is on the side that has a window, they're able to go to the window and see them. But some people don't even have that luxury, or they have to use Zoom calls. So it's just very challenging. So my heart goes out to you. It is a tough time. And then now to think about, with all the risks, having to bring your loved one into a facility, that's also hard too. So what I would say to you is to, one, ask questions, which I know Dr. Nicole always emphasizes here. Read, inform yourself, ask questions. All the data in the state of Maryland, all the data about nursing home COVID cases is online. So you don't even need to necessarily ask the facility if they have COVID cases. I would first go on and look, and then I would go into the conversation with that information. And even if they say there are no cases, then the next question is still the same for anyone. You want to ask what they're doing to prevent it, Do they have a dedicated COVID unit for patients that are there? What is the testing rate? Are they testing their patients? Because maybe they have no cases because they haven't been testing.
Good
So are
point.
they testing patients? Are they testing the staff? Where's the COVID unit? What infection control measures are they taking? Have they been visited by the infection control regulators? Like, has the National Guard come through? Has the state health department come through? So these are the questions you want to ask just to make sure that they're where they need to be before you bring your loved one in. And then how will your loved one be protected? For most facilities, one thing I didn't mention in the beginning, they have stopped community events. They have started doing the rehab in the rooms with the patients, and so limiting the shared spaces. So is that still going on? When do they plan to reopen those facilities? When will they stop their COVID precautions? Is that in plans yet? So those are the questions you should ask.
Those are excellent. Wow. Those are amazing. Thank you. And Dr. Sylvia has written an article all about, her experiences in the nursing facility during COVID-19. It's on LinkedIn. I'm going to drop the link to that in the comments, and I encourage you all to please check that out. And Dr. Sylvia, thank you so much. This has been so helpful. And, hearing it's one thing for us to read about this or hear about it on the news, but to hear it from someone like you who's on the front lines and just who is, clearly passionate about this and compassionate is just really like a breath of fresh air. So thank you again. How can we find you for viewers who want to learn more about Dr. Sylvia? How can they find you, either on social media or wherever?
Oh, sure. So thank you once again, Dr. Nicole, for having me, for allowing me to have this platform just to share and to share what I've learned with your viewers. And I truly hope that it helps them. And I pray for their loved ones wherever they are, whatever facility, and that they stay COVID-free. And for those who've already been impacted by COVID-19, just that they can find some comfort and find some relief and healing in this process as well. I do believe, I think, like you mentioned, with everything that we've both gone through, the best thing that can come out of a negative situation is finding a positive solution and finding positive change. So that's the best thing that can come out of any negativity that happens in your life. So for me, you can find me. I have my website, www.drsylviagbollie.com. And then I'm also on Twitter, Instagram, Facebook, LinkedIn at Dr. Sylvia MD. And I primarily share healthy living tips. Obesity medicine is my primary specialty. So I share things about healthier living and how to stay at your happy, healthy weight for the rest of your life.
We can all use that information for sure. Thanks again, Dr. Sylvia. Thank you to all of you for tuning in to another episode of Navigator Nuggets. Please share this video with others, particularly if you have people in your circle who have a loved one in a nursing facility. Please share this useful information. And I look forward to being with you all again next Monday night at 8:00 p.m. Eastern Standard Time. Take care.
Thank you. Bye, everyone.